Hello all, today we are going to discuss about the facial nerve and its applied anatomy. The facial nerve is also known as the cranial nerve 7. It's a mixed nerve, meaning that means it performs motor, sensory and parasympathetic functions. It is essential for several critical activities in the body. From a motor perspective, the facial nerve controls the muscles of facial expression, everything from smiling to frowning. Sensory wise, it is responsible for providing taste sensation to the anterior two-thirds of the tongue, and parasympathetically, it regulates the secretion of saliva through the submandibular gland and sublingual gland, as well as tears through the lacrimal gland. So, in short, the facial nerve is vital for movement, sensation, and moisture regulation of the face. This foundational understanding will help us to better explore its anatomy and clinical significance in the next section. The nerve begins in the pons, which is a part of brainstem. From there, it goes into the internal acoustic meatus, which is a small opening in the skull near the ear. Inside the skull, it travels to the facial canal, which is like a tunnel in the temporal bone. And from there, it exits the skull through the stylomastoid foramen, which is a hole behind the ear. And once outside, it splits into 5 main branches to control the facial expression: temporal, zygomatic, buccal, marginal mandibular, and the cervical. So this pathway allows the facial nerve to do its job of moving muscles, providing taste, and making tears and saliva. Let's simplify the 5 motor branches of facial nerve that control the muscle of facial expression through a well-known mnemonic: to Zanzibar by Motaka, where the T stands for the temporal branch, Z stands for the zygomatic branch, B stands for the buccal branch, M stands for the marginal mandibular branch, and C stands for the cervical branch. Some of the other branches of facial nerve is greater petrosal nerve, which helps to make tears by controlling the lacrimal gland. Chorda tympani nerve, it gives a taste to anterior two-thirds of the tongue, and it also helps with the saliva production in salivary glands. The third branch is nerve to trapezius. This nerve controls a tiny muscle in the ear, the stapedius, to stabilize the stapes bone and reduce the loud sounds. Now coming to the diagnostic approach for facial nerve disorders. It involves several critical steps to gather the information to evaluate the severity of condition and differentiate between the potential causes. The first step in diagnosing the facial nerve disorder is to take a detailed history. Means asking the patient questions about their symptoms such as onset, when did the symptoms begin, were they sudden or gradual. A sudden onset may indicate a Bell's palsy, while a gradual progression may point to a tumor or other conditions. Then second, we should take a history of duration and the progression. How long have the symptoms been present? Are they improving, staying the same, or worsening over the time? For example, Bell's palsy often resolves in weeks, while conditions like Ramsay-Hunt syndrome may worsen without any treatment. Ask about the pain, hearing loss, or dry eyes. Pain may suggest Ramsay-Hunt syndrome, while hearing loss could point to a tumor or the middle ear infections affecting the facial nerve. History of the trauma should also be ruled out, because any history of the head trauma or surgery might affect the facial nerve. The next step is thorough physical examination to evaluate the function of facial nerve. The patient should be checked for facial symmetry at resting position. We have to also inspect any atrophy and fasciculations, spontaneous blinking, synkinesia, nasolabial fold with forehead wrinkles should be inspected. The wide palpebral fissure should be evaluated, and also observe the movements during the spontaneous and voluntary facial expressions. For testing temporal branch of facial nerve, the patient is asked to frown or wrinkle his or her forehead. For testing the zygomatic branch, the patient is asked to close the eyes tightly. And for testing the buccal branch of facial nerve, the patient is instructed to puff up cheeks, smile or show teeth. Tap with finger over each cheek to detect ease of air expulsion on the affected side. After motor examination of facial nerve, we will go for the sensory function examination. We'll check for the taste sensations which are carried by the chorda tympani branch of facial nerve. Ask the patient to stick out their tongue and place a small amounts of sweet, salty, sour or bitter solutions on the interior two-third of the tongue, one side at a time. So ensure the patient keeps their eyes closed and identifies the taste and compare the response between both the sides. Also, we have to check the external ear sensations by lightly touching or stroking the small area of skin around the ear canal and external ear, which is innervated by facial nerve. Ask the patient if they feel the touch and if there is any difference between the two sides. The secretory function of facial nerve primarily involves the stimulation of lacrimal gland, submandibular gland, and sublingual salivary glands. The secretory fibers originate from superior salivatory nucleus and they are carried via a greater petrosal nerve and chorda tympani branch of facial nerve. Schirmer test is used for functional examination of lacrimal glands. Place a strip of filter paper in the lower conjunctival sac of each eye and ask the patient to keep their eyes closed for 5 minutes. Measure the length of the moistened strip. A normal tear secretion moistens about 10 to 15 mm in 5 minutes and compare the results of both the eyes. And for submandibular and sublingual salivary gland examination, a cotton swab or visual inspection is done. Ask the patient to relax their tongue. Use a cotton swab to stimulate the floor of the mouth gently. Observe the openings of Watson ducts for salivary flow and compare the flow rates bilaterally. Alternatively, measure saliva production using salivary flow collection test. After the history taking and physical examination, if the clinical examination suggests a facial nerve disorder, imaging and additional tests are necessary for a more detailed diagnosis. MRI is particularly useful for identifying tumors, inflammation, or structural issues like multiple sclerosis affecting the facial nerve. CT scan is useful for detecting any fractures, especially around the skull or the temporal bone, which could affect the facial nerve. Electromyography measures the electrical activity of facial muscles to assess the extent of nerve damage. And blood tests help to detect the systemic conditions like Lyme's disease or the viral infection that can lead to facial nerve involvement. Coming to the clinical relevance, the facial nerve disorders can be classified based on their etiology, anatomical location, or functional involvement. We will be dealing with the facial nerve disorders elaborate manner in the coming videos for sure. Dry mouth occurs when the greater petrosal nerve is damaged because the nerve's parasympathetic fibers are responsible for stimulating salivary production, and loss of taste happens due to damage to sensory fibers of soft palate. Damage to stapedius nerve can cause hyperacusis, which is because the stapedius muscle which dampens the sound is not functioning properly due to stapedius nerve impairment. So hearing impairment can happen if stapedius muscle is not regulating sound intensity. In case of damage to chorda tympani branch or facial nerve, there is loss of taste in the front part of tongue which occurs when the sensory fibers carrying taste are damaged. And dry mouth may also occur when parasympathetic control over salivary gland is affected. When the main motor branches of facial nerves are affected, it may lead to facial paralysis, which can lead to asymmetry in the facial expressions and loss of function in facial muscles like smiling or blinking. Drooping and the other issues can result from facial nerve damage, causing difficulty with the basic facial movement. The general pathologies of facial nerve involves a facial nerve paralysis that can occur due to infections like Bell's palsy, trauma, or tumors. It leads to muscle weakness or paralysis. In dental practice, when the local anesthesia is given, the care is required during the inferior alveolar nerve blocks to avoid injuring the facial nerve near the parotid gland. Incorrect injection may lead to temporary facial nerve paralysis. In case of third molar surgery, awareness of the proximity of marginal mandibular branch is crucial to prevent its injury. Also, the identification of facial nerve branches is essential during the fracture management, especially in case of mandibular fracture. The buccinator muscle aids in maintaining the position of the dentures and distributing chewing forces. And paralysis of facial muscle as it occurs in the Bell's palsy may impact the oral functions, leading to drooling or difficulty in eating. The facial nerves parasympathetic fiber control salivary secretion from the submandibular gland and sublingual glands, relevant for dry mouth conditions in dental practice. So this was an introductory lecture of the facial nerve. Hopefully in the future we'll be covering more topics under facial nerve. So see you in the next video. Till then, bye bye, take care, have a nice day. And don't forget to like, share and subscribe to the channel. So see you in the next video. Till then, bye bye, take care.